Welcome to the Provincial Healthcare Violence Prevention Program learning modules. These presentations are brought to you through the efforts of regional health authorities and Manitoba Workplace Health and Safety. The Violence Prevention Program was developed following the amendment to the Manitoba Workplace Safety and Health Legislation Act of 2011 that required violence prevention for all healthcare workers. A working group of safety and health specialists developed this program to meet compliance with the Act. The results of that work has given us these 6 training units to educate and equip the healthcare workers of Manitoba in the matters of violence prevention. There will be 4 units that will be prepared via audio and video feed that you will be available to view at your own convenience. Depending on your role or position at Action Marguerite, you may be required to view all or some of these presentations. Please speak to your manager to find out what units you are required to complete prior to beginning these units. After you complete your unit, your manager will provide you with a small quiz, and you are responsible to complete. Please ensure you write your name, first and last, date, position, and facility at the top of your quiz. A facility binder is available at reception to view the Workplace Safety and Health Regulation 217/206, the Manitoba Health Policy for Violence Prevention Program for healthcare workers in Manitoba, the Workplace Violence Prevention Guidelines, the Provincial Healthcare Violence Prevention Program Operational Procedure, and a copy of the Provincial Legislation Act. These will also be available through a link so that you're able to view them online. Each unit will have a presentation and/or video for you to watch. You are able to read the slides or choose to lower the volume if you wish. You may also press the arrow key to advance to a new slide or the next slide. At the end of each unit, please complete your quiz and forward it to your manager. After you complete your unit, you will receive a certificate for the units that you have completed for your personal records. If you're not able to complete the presentation during the first sitting, you can return at a later time and advance to the slide that you left off by using the arrow keys. Welcome to the Violence Prevention Learning Presentation. Orientation to the Provincial Violence Prevention Program is required for all healthcare workers. Healthcare workers are among the highest risk group of becoming a victim of violence while on the job. Awareness, screening, orientation, and training for early interventions are keys to injury prevention for all healthcare workers and individuals we care for. Healthcare workers is a term for all people working in all areas of healthcare, whether it be residential care workers, home support workers, or direct service providers. There are about 50,000 healthcare workers in Manitoba. Healthcare industry accounts for 49% of the incidence of injuries related to workplace violence. 90% of those injuries are from patients. Healthcare workers are highly committed to their clientele and often endure behavior that they would not tolerate under any other circumstances. Training units include Unit 1, Orientation to the Provincial Healthcare Violence Prevention Program, Unit 2, a relationship building model for violence prevention in healthcare, service excellence. Unit 3, using a patient screening and alert systems. Unit 4, managing violent, aggressive, and responsive behaviors. Unit 5, core training for managers and supervisors. Unit 6, how to conduct a workplace violence program assessment. You may be assigned units depending on your role or position. Sites may alter based on considering some of the following: most vulnerable, direct care involvement, working alone, isolated in homes, high-risk area, known risk areas, high-risk population, potential for harm or death, historical data, ability to respond or to have others respond to need, financial impact, public perception, and current status of trained or ready staff. Unit 1, Key Learning Points. Effects of workplace violence on healthcare workers in Manitoba. Roles and responsibilities of healthcare workers. Recognizing types of violence and responsive behaviors. Patient risk screening and the use of alert systems. When and how to summon immediate assistance. A worker is defined as any person who works in any healthcare setting across all sectors. This includes acute care, home community, and long-term care. A patient includes residents and clients. Visitors includes family members and members of the public. Some definitions. Manitoba Health Policy and Violence Prevention defines violence as any act that results in injury or threat of injury, real or perceived, by an individual, including but not limited to acts of aggression, whether intentional or not, verbal or written threats, vandalism of personal property. Violence is further defined as acts of aggression and or responsive behaviors, whether intentional or unintentional, and or arising out of medical conditions for which the individual seeks care for. Responsive behaviors is a term that represents how people living with dementia often respond unpredictably to something negative, frustrating, or confusing in their environment. Behaviors may include aggression, agitation, wandering, physical acting out, or physical resistance to care. The reasons or triggers for behaviors may be external rather than within the individual, also known as challenging or troublesome behaviors. Dementia affects the person's memory, thinking, language, problem solving, and self-awareness. The person doesn't know that he or she does not know. Some sites use the phrase challenging or troublesome behaviors. Types of violence and responsive behaviors include physical, hitting, biting, kicking; behavioral, pounding at a wall, stalking; verbal abuse includes swearing, demeaning comments; conditional threats, if you don't, or leaving notes; sexual includes comments and grabbing. Contributing factors. We provide care for people that may act impulsively either on purpose or unintentionally, such as people using drugs or alcohol, with communication barriers, who are cognitively impaired, with disease processes, experiencing crisis, and with fear of the unknown. Contributing factors: lack of training and or policy to deal with situations and people, security, staff response, so many cultures, our work environments or people's homes, unrestricted movement of public and facilities. Effects of violence on healthcare workers range from minor to serious physical injuries, temporary or permanent disability, psychological trauma, and death. Manitoba Violence Prevention Program for Healthcare Workers in Manitoba, Policy Number HSC 215.5, and the Provincial Healthcare Violence Prevention Program Operational Procedure must be posted in a visible location in the workplace. Examples include Safety Bulletin Board, a policy manual, communication manuals. Everyone has responsibilities. Employers must ensure workers have training to manage situations they come across. Safe visit plans and care plans are followed. Workers are aware how to summon help. Directors, managers, supervisors, and charge person must ensure workers are aware of risks and hazards they may encounter. Appropriate education and training is mandatory. Training and education is documented, such as a quiz. Policy and procedures are enforced. Incidents are reported and then investigated. Workers must attend orientation, use alert system, follow safe visit or work plans and care plans, report all incidents, seek medical help or counseling when needed, follow policy and procedures, apply strategies to reduce inappropriate behaviors, stop procedure or task, try again later, seek help from another worker when needed, try setting limits. Workplace assessments. Important to the success of the Provincial Healthcare Violence Prevention Program is looking at the physical workplace. A training unit is available on how to conduct a workplace violence program assessment. Workplace assessments include location, characteristics of workplace and specific populations, security incident history, worker injury and near-miss history, present state of violence prevention program. Violence prevention program workplace assessments may be department specific. Employers must develop reasonable methods of summoning immediate assistance when an incident has occurred or is likely to occur. Examples may include code white teams or disturbance response teams, how to contact summon police assistance, as well as RCMP, panic alarms, and personal alarms. At Action Marguerite, we utilize a code white procedure. There is a policy that is available in the red codes binder that is available at every nursing station. There are also panic alarms that are available on the locked units on 2C, 4C, and 5C. Please ensure that you are wearing a panic alarm when you are working on these units. You simply press the purple button that is located on the panic alarm. This will ring to the neighboring unit. The neighboring unit is responsible for sending 1 to 2 staff members over to assist with the situation. The other staff member remains on the neighboring unit and calls a code white. Person of interest protocols. A person who is not seeking medical attention and who is known to be a high risk for violence is known as a person of interest. Each region and site must develop a process for a patient, employee, family member, etc., a key informant, to report such a person. The procedure must include ways to notify security or designated persons, and a method to communicate alert to all workers who need to know, and the process to follow if the individual presents. Patient risk screening and use of alerts. All patients are asked questions when first coming into care. Their actions are observed for violent and responsive behaviors. This process is called screening. All patients are screened so risk of violence can be identified and communicated to all staff that may be in contact with the person. Screening tools are a permanent part of the patient record. Tools may look slightly depending on the site or program. Screening is not a full assessment. Screening is not the same as a full clinical or patient assessment. However, a positive screen should prompt a more in-depth assessment. Healthcare workers who are normally the first point of contact with patients will require further training on the specifics of conducting patient screenings and activating alerts. This information is in Unit 3, Using Patient Screening and Alert Systems. Screening criteria includes evidence of actual violence or aggression, past history of violence or aggression, and current risk factors. When initial screening reveals risk of violence or responsive behavior, an alert is activated using the provincial symbol for violence prevention. The provincial symbol stands for Use Care, Caution, and Respect every day. Alerts prompt workers to speak with care providers prior to entering a room or providing care. A symbol may be on a door or above a bed, on a wristband, in a service plan, a communication logbook, a client file or care plan or Cardex, or an alert binder, or any combination of the above. Please speak to your manager about where alerts will be posted in your area. If an alert has been activated, a safe visit plan or patient care plan must be initiated. The safe visit plan or care plan should provide the worker with more details on how to communicate or work with the patient. All workers must follow care plans and safe work plans. Anyone feeling at risk while in contact with a patient must communicate concerns to the supervisor or charge person. Rescreening is to be done if behaviors change or new information becomes available. Changing the alert status. Deactivating. The alert must be removed if reassessment reveals no risk. Maintaining upon discharge. If potential or actual risk of violence has not been mitigated or eliminated, the alert remains active. Upon transfer of care, alert must be communicated along with care plans, safe visit plans. Review or correction to the health record. Under FIA, an individual can request review or correction of information following site policy and process. The alert may be deactivated, but it's important to remind staff that the history will always remain on the patient record. Communication with other healthcare providers. What can I tell other healthcare workers about a patient's alert status? Healthcare workers may share the individual's personal health information with any healthcare provider who has, is, or will be providing healthcare. All personal information provided must be to the minimum amount necessary to accomplish the purpose. Communication with patient and family. Patients, family, and visitors will ask what the alert symbol means. An appropriate response is, this person has a special care plan. An alert is personal health information and should be treated as such. Reporting and investigating. Workers must report all incidents of violence, aggression, responsive behaviors, or abuse. Incidents must be reported following your site, program policy, or procedure. Investigations are not about blame. The purpose is to find out why it happened, put in corrective actions where required, and prevent the same type of incident from happening again. Remember, if it's not reported, it didn't happen. Please ensure you are also documenting occurrences as well. Post-incident care. Immediately after the incident, scan the environment to ensure safety. Am I safe right now? Do I need physical care or first aid or the ER? What support do I need? Who is available? Ensure all paperwork is done. Documentation on the patient's record. All reports are to be filed. Please ensure that you are completing a post-event debriefing or a post-event huddle to identify what worked well, what requires improvement, how is the team feeling with the situation that happened, and how did the situation affect the resident. This is very important in identifying issues within our organization and how we can strengthen our policies and procedures, as well as how we can better support our team. Violence prevention is everyone's responsibility. Violence at work is not accepted as just a part of the job.